Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we elaborated on the first anxiety disorder, namely the panic disorder, in detail. In this episode, we consider the second anxiety disorder, the phobias, in detail. A phobia is an anxiety disorder. It involves excessive, persistent, intense, and irrational fear of a situation or an object that poses little or no actual danger. However, this excessive fear results in the avoidance of the situation or object or bearing it with extreme distress. Some phobias are centered on a specific fear object, while others are complex and tied to different situations or circumstances. Exposure to the specific source of fear triggers an immediate anxiety response, causing a significant disruption in a person's functioning and well-being. In order to understand the true nature of a phobia, we must distinguish it from a fear. For not every fear is a phobia. Many people may experience fears or aversions to situations or objects. However, these fears or aversions need not necessarily mean that they would be diagnosed with a specific phobia. Since mental health professionals cannot diagnose a phobia and differentiate it from fear by using any type of lab test, they can use the following criteria to diagnose a phobia and distinguish it from a regular fear. Firstly, a phobia involves unreasonable, excessive, irrational, and persistent fear that is triggered by a specific object or situation. Secondly, a phobia involves immediate and instantaneous fear response to the presented situation or object, and the fear response is out of proportion to the actual danger presented by the situation or the object. Thirdly, a phobia causes avoidance or extreme distress. A person with a phobia goes out of his or her way to avoid the situation or the object or endures it with extreme distress. Fourthly, a phobia can be life-limiting in that it can have significant impact on an individual's regular life, such as schoolwork, job, or personal life. Fifthly, in children and in adults, if the phobia symptoms last at least for 6 months duration, then it would be considered a case of phobia. Sixthly, since many anxiety disorders have similar symptoms, the mental health professional should make sure that the symptoms are not from any other anxiety disorder, such as panic disorder or obsessive compulsive disorder, in order to consider the given case as a phobia. Thus, a fear is different from a phobia. People with phobias manifest physical, psychological, and behavioral symptoms. Physical symptoms are tightness of chest pain, chills or hot flashes, choking sensation, rapid heartbeat, shortness of breath or breathing difficulties, shaking or trembling, dizziness, dry mouth, increased blood pressure, nausea, and sweating. Psychological symptoms are experiencing panic or extreme fear, feeling of dread, a strong desire to get away from the situation, a sense of impending doom, fear of losing control, and feeling that death is imminent. Behavioral symptoms are avoiding the situation of fear, being confined to their homes, and dodging issues that might create or aggravate panic. Though it is difficult to identify the exact causes of phobias, we can know some of the factors that increase the risk of people developing phobias. These factors include, firstly, genetics. People with close family member with a phobia or other anxiety disorder have greater risk of developing a phobia. However, people with no family history of phobias can also develop phobias. Second, traumatic experiences. Difficult, stressful, or traumatic experiences can trigger the starting of a phobia. For instance, being bitten by a dog as a child might trigger a fear of dogs in adulthood. Thirdly, temperament. Research suggests that people who exhibit behavioral inhibition during childhood, such as fearfulness, shyness, or withdrawal in new or strange environments, have a higher risk for developing different anxiety disorders, including specific phobias. Phobias are broadly classified into three categories: social phobias, agoraphobia, and specific phobias. Social phobias, also known as social anxiety disorders, are marked by extreme fear of social situations in which a person might be judged or feel embarrassed. When you have a social phobia, you may find it hard to handle everyday situations such as interacting with strangers or unfamiliar people, attending parties or social gathering, going to work or school, making eye contact with people, going for a date, entering a room where people are already seated, returning items to a store, eating in front of others, using a public restroom, and the like. Agoraphobia is characterized by an irrational and extreme fear of public places, such as open spaces, crowded place, a place outside home, or places from which escape seems difficult. Specific phobias involve extreme or irrational fear of specific objects, such as snakes, spiders, needle, and the like. Specific phobias are categorized into 5 types. Phobias related to nature or environment. For example, astrophobia, extreme fear of thundering and lightning, and aquaphobia, uncontrollable fear of water. Phobias related to animals or other living organisms. For example, cynophobia, intense fear of dogs, entomophobia, strong fear of insects, and mysophobia, intense fear of germs, viruses, dust, or other contaminants. Phobias related to medical treatment or injury associated with it, such as dentophobia, intense fear of dental treatment or dentist, and trypanophobia, intense fear of injections. Phobias related to specific situations, for example, acrophobia, intense fear of height, and aerophobia, intense fear of flying. Phobias of other types. This category includes phobias not included in the above 4 types, such as fear of loud sounds, fear of dolls, fear of vomiting, fear of buttons, and the like. Thus, any object or situation can become the source of fear, leading to the origins of a phobia. Phobias affect 19 million adults. Some people experience multiple specific phobias simultaneously. Approximately 75% of people with specific phobia fear more than one object or situation. Women are 2 times more likely than men to have a specific phobia. If diagnosed on time, phobias can be treated and people can recover completely from their fears and anxieties associated with their phobias. Often, medication, therapy, or both are used in treatment. In the next episode, we will speak about the third anxiety disorder, the obsessive compulsive disorder. Thank you for watching this video. Stay blessed until we see you again with another video.